Hi, everyone, and welcome to the SRHM Podcast, which explores new research and emerging trends in the field of sexual and reproductive health and rights, with a focus on using rights-based knowledge for action.
Hello for everyone who is listening to this podcast. Good morning, good afternoon, good evening. I'm Eszter Kismödi. I'm the Chief Executive of Sexual and Reproductive Health Matters, talking from Geneva today. And really warm welcome to our guests today, Katie Mayall, Laurenne Ajayi, and Caitlin Gruer, the authors of the new article, Global Progress in Abortion Law Reform, a Comparative Legal Analysis since the International Conference on Population and Development, published in the SRHM Sexual and Reproductive Health Matters most recently. We are really thrilled about this article. Katie, Laurenne, and Caitlin, thank you so much for being here.
Thank you so much for having us.
Just a little bit of introduction for the listeners. So Katie Mayall is former director of strategic initiative at the Center for Reproductive Rights, New York. And now she's running her consulting practice. Laurenne Ajayi is previously a legal fellow at the Center for Reproductive Rights in Nairobi, Kenya, at the time of writing the article, and now a doctoral researcher at the University of Sussex. And Caitlin Gruer, manager at the Center for Reproductive Rights. So I am really very pleased to dive into a discussion about your article that we just recently published. It's really a fascinating article in a very difficult time of our today world. And it's really something that gives good energy. It's a fascinating and critically important analysis on how countries have reformed, or in some cases, restricted abortion laws in the past 30 years since ICPD. And it's an incredibly comprehensive look at global and regional shifts. And it really underscores how essential is that abortion continues to be recognized as a fundamental human right or fundamental human rights. So I turn to you first, Katie, before we dive into the details. Could you give us a brief summary of the key findings of your mapping and analysis?
Absolutely. So we found that since 1994, there's been an overwhelming global trend towards the liberalization of abortion laws. Over 60 countries have liberalized their laws, while only a handful of countries have removed legal grounds for abortion. But one of the most striking findings is that more countries have adopted abortion on request in the last 5 years than in the previous 25 years combined. So we've really seen a seismic shift towards abortion law reform, recognizing abortion on request as opposed to a sort of enumerated or more limited grounds. And I think this is really representative of the shift we're seeing to recognize abortion as both a human rights and a public health imperative. And increasingly, countries are rejecting smaller, more incremental approaches in favor of those that really center autonomy and choice. One thing we really wanted to do with this article, though, was go beyond just sort of tallying the different reforms that have occurred to really look at what this means for populations in countries and globally. So what we did was pair population data with the reforms that we are seeing to understand what this means for people who need abortion care. And we found that today, more than 825 million women of reproductive age live in countries that have liberalized their abortion laws since ICPD. And I think that's something all of us in the reproductive health and rights movement should be really proud of.
Absolutely. And I think it's just really amazing to know this evidence-based information. And in order to recognize this evidence, it would be before we go into the more rigorous data presentation that you are providing in this article, can you please, Caitlin, tell us more about the mapping and the methodology? The Center, for those of us who are working for myself more close to 30 years, we are really celebrating the possibility that the Center for Reproductive Rights is using a very unique framework for analyzing abortion laws globally since basically 1998. Can you tell us more about the methodology and how does it shape the findings of this article?
Absolutely. So the Center has tracked abortion laws in all UN member states for decades. We use a 6-category framework to do this that maps laws from the most restrictive to the least restrictive. So that's from countries where there are total abortion bans in place to countries that allow abortion on request. So for this article, we analyzed legal changes from 1994 to 2023, looking not just at what changed, but when, where, and how things changed. We also examined the legal grounds that countries use, like to preserve health in cases of rape or for socioeconomic reasons, and how these categories have evolved over time. This method allowed us to trace both the pace and the direction of legal reform across time and regions.
And as I read it, your methodology also reveals some important global trends over the past 3 decades. What are these trends showing, Laurenne?
Thanks, Esther. So one major trend is acceleration. Especially in the last 5 to 10 years, we've seen a global push towards the liberalization of abortion laws, including some countries legalizing abortion on request where it was previously entirely banned. There's also growing recognition of abortion as a human rights issue, which is influencing court rulings, constitutional reforms, and also international advocacy. However, we are also seeing backlash, especially in contexts where far-right movements are gaining strength. The US is a major example, but we also saw regression in Poland and in Nicaragua. So while the overall trajectory is towards greater legality, there are outliers and still a lot of work to be done. For example, 25% of women of reproductive age still live in countries where abortion is only permitted to preserve the pregnant person's life or is banned altogether, which is really striking given the tremendous progress that we have otherwise seen.
Why I also love your article, and I think it's very important for the reader and for the data analysis that you have very specific, as you mentioned, country-specific examples. I'm turning to you, Katie, can you give a couple of examples, both where laws have liberalized and when they have become more restrictive?
Overall, there's a lot of regional variation. As Katie mentioned, Latin America and the Caribbean have seen significant momentum recently, driven by strong feminist movements that have built strong intersectional support from other progressive movements. Similarly, the Africa region has had the greatest number of countries liberalize their laws in the past 30 years, with 25 countries enacting these reforms. However, around half of women of reproductive age in both Latin America and Africa still live in countries in the 2 most restrictive categories, where abortion is banned altogether or is only permitted when the pregnant person's life is at risk. In Asia, there's been quiet but steady reform in places like South Korea and Thailand. However, it is still the region where the greatest number of women of reproductive age live in countries in the 2 most restrictive categories. Europe is mostly liberal, but with serious exceptions like Malta and Poland. So, while progress is happening almost everywhere, the pace and pathways vary greatly.
So looking at these trends, country examples are incredibly important, but what are the main analytical points that your article communicates looking at this data? And I'm not sure who would like to pick up this question. So can we dive in a little bit about the analysis and what it reveals?
Yeah, of course, I'm happy to take that. So there are seismic shifts underway towards both the liberalization of abortion laws and countries reforming their laws to allow abortion on request. But this work is far from complete, and there are still really important strides to make. Also, legal change alone just isn't enough. Without implementation, so training providers, allocating resources, addressing stigma, rights on paper don't necessarily translate into access in practice, especially for groups that have been historically marginalized and underserved by healthcare systems.
Again, preparing for this, I saw your abortion map and I was so happy when you submitted the article for SRHM, and I'm so happy that we are here today to talk about it. What are the key conclusions that you want the listeners to take away as we look at the future and as they hopefully will read and work and cite and really work with this very important analysis? What are the key takeaway messages? I'm turning to you, Katie.
Absolutely. So I think in a time right now of rising authoritarianism and shrinking civic space, and sort of all the bad that we see out there, I think it can be really easy to get bogged down in all the work that still lies ahead of us. But I feel like this paper is really evidence of the incredible progress that feminist movements have made on abortion rights over the past 30 years. And how this has actually accelerated in just the past 5 years feels really inspiring to me. So I think of this paper as an important moment for us to really celebrate all the progress that's been made. But at the same time, of course, we have to remain vigilant in the coordinated opposition and the devastating rollbacks that we've seen. So it still is just as important, if not even more important, that we continue to create broad and strong coalitions and that we employ approaches that support related justice and human rights movements. I think one more thing we need to also think about is how we continue to maintain a vision of true reproductive autonomy, where abortion isn't just legal, but is actually treated as a human right. So that means thinking about ensuring that abortion is fully decriminalized, that people who want to self-manage abortions are enabled to and supported in doing so, and to make sure that we're also investing in the social and economic supports to create meaningful decision-making around pregnancy and childbirth for everyone.
Fantastic. I'm really very thankful for the Center for Reproductive Rights, for the three of you for writing up this article and for the fantastic work that you are doing. There are many points in the coming months when we can work with this article. We have World Contraception Day, Safe Abortion Day, the upcoming International Family Planning Conference, the Human Rights Council, regional meetings. Thank you so much for the article, and for the listeners, I really, really recommend to please find our article on our website or on the Taylor and Francis website, Global Progress in Abortion Law Reform in Sexual and Reproductive Health Matters Online Now. Thank you very much for listening, and thank you, Katie, Laurenne, and Caitlin for being here today with us.
Thank you so much for having us.
Thanks for joining us for this insightful conversation. Please check the show notes for a link to the SRHM Journal, which is available online and open access. Follow us on social media and sign up for our newsletter to receive notifications for new publications. If you're enjoying this podcast, please subscribe, give us a rating, or leave a review. Sharing evidence-based and rights-grounded knowledge is our passion, and it's also critical to support the advocacy and actions that need to be taken to improve SRHR for all. We would very much appreciate it. Thank you for supporting the SRHM Podcast, which is produced by our staff. The music was composed by Tiber Christian and Salomon Bouton.